Assalamu alaikum. My name is Riyadh Alzahrani. Today I will present AA470 project about safety screening in MRI room. The agenda starts with the introduction, then we'll go through the safety zones, procedures before entering the MRI room, and conclusion. The MRI is a safe technique in medical imaging, which is no radiation, but the magnetic field in MRI is very dangerous, and there are guidelines and procedures you have to follow it. Otherwise, the patient will be in danger situation and maybe lead to harm him or death. In the MRI department, there are 4 safety zones that determined by the American College of Radiology that are corresponding with the increasing the level of magnetic field exposure. Zone 1, all areas freely accessible to the general public without supervision. Magnetic fringe field in this area are less than 5 Gaussian. Zone 2 is still a public area, but the interface between the unregulated area 1 and the strictly controlled area of the third and fourth area. MRI safety screening occurs here under the supervision. Zone 3, an area near the magnetic room, where the fringe gradient or RF magnetic field are sufficiently strong to present a physical hazard to unscreened patient and personnel. Zone 4, synonyms with the RM magnetic room itself, has a highest field and greatest risk, and from which all ferromagnetic objects must be excluded. As mentioned before, the screening occurs in Zone 2. In the area, the patient must fill the form about the safety and many questions about the objects that will affect to the magnetic field and the implant devices in the body or head, such as including a pacemaker, internal defibrillator, neurism clips, and coils. So as you can see in this picture, a sample form about the procedures and the questions. After the patient filled the form and answered all questions, the supervision checked the form and evaluate if the patient failed to do the MRI or not. If he is failed, after that will alert the patient to remove all the mechanical, magnet and metal objects from your clothes and body. You might be asked into to change the hospital gown. Finally, the safety is most important for all devices, but the MRI it's must be very high because of when there are mistakes occurs, the patient life will be in the danger situation. Therefore, the MRI procedures takes a longer time than the other procedures in the medical imaging. Uh, to make sure the safety patient and there are no problem to do the MRI. Also, some patients need to do the test blood or to check for the kidney function. And thank you for your listening.